name is Dr. Leggett. How are you?
Good. How are you? Nice to meet you.
Good. I'm going to be your clinician today. So before we start, do I have your consent to be my patient?
Yes.
Great. Before the video, I took her vital signs and I washed my hands. Now I'm putting on my PPE necessary for the neurological assessment. So this is Haley. She is a 23-year-old female who's active, does not have a history of disease, illness, or drug use, has no family history of illness. She drinks recreationally and she does not smoke, and she appears healthy and in good spirits. And that's all from my assessment that I did prior to recording. All right, so to begin the neurological exam, I'm going to look at your cranial nerves. You have 12 cranial nerves, and they help you do things like your eyesight, hearing, your speech, and I'm just gonna make sure that everything is working properly and that there's no gaps. Is that okay?
Awesome.
Great. So we're gonna start with cranial nerve 1, and as we work through these, I'm gonna be taking notes, jotting them down, so that's why if I look down, that's why. So your first cranial nerve is your olfactory nerve. So I'm gonna test your sense of smell. So I'm gonna have you block one nostril, sniff in, great. Other one, great. Now I'm going to test your cranial nerve 2, which is your optic nerve, which helps you see. So I'm going to take my Rosenbaum chart here, and I'm going to step away from you. Here is her chart, and I'm going to have you cover one eye and read from this line right here.
E, D, F, C, Z, P.
Great. Now cover your other eye, and I'm going to have you read from this line here.
F, E, L, O, P, Z, D.
Great. Can you read from this line?
With this, I can still cover?
Yeah.
Okay. D, E, F, P, O, T, E, C.
Great. And then, yep. This line?
The same one?
Yep.
D, E, F, P, O, T, E, C.
Great. That was great. You got them all correct, which means with your glasses, looking good. No need to change up your prescription.
Awesome.
All right. So now I'm going to test your visual field. Still looking at your optic nerve, but we're just going to do a little test. So what I'm going to do is I'm going to wiggle my fingers, and I'm going to start from behind, and you'll tell me whenever you see my wiggling fingers, and we're going to do this one at a time. So I'm going to put my hands back here. Let me know when you see my fingers wiggle.
Yes.
Okay.
Yes.
Great. That's within range, looks good. And now I'm going to do it again, just from your lower quadrant, so let me know when you see my fingers.
Yes.
Yes. Great. Everything's looking good there, so now I'm going to look at your eye at a deeper level. I'm going to measure your pupil and see how you react to light. Is this okay if I shine it in your eye?
Do I give it a
Yes. Okay, so look at me. Great. Good reaction to light. Everything looks good. Your pupils are 2 to 4 millimeters in size. That's perfectly normal, so we're good there. All right, so last thing, I'm going to have you focus on the pen, and I'm going to move it close to your face, so I'm going to look at your convergence.
Should I put my glasses back on or no?
No, keep them off for this. Great. All right. And that's all good. So now we're going to move on to cranial nerve 3, your oculomotor nerve, and 4 and 6, trochlear and abducens, looking at your extraocular movement. So I'm going to draw something in the air. I want you to follow my finger. Great. That was just a large H to make sure all directions of your eyes are going the right directions. Now I'm going to have you follow my finger again. Great. And now we're going to move on to cranial nerve 5, your trigeminal nerve. And this tests your temporal and masseter muscles. So I'm going to have you, I'm going to touch your temporals first and then your masseters. I'm going to have you clench your teeth, okay? Yeah. Clench. Great. Great. All right, moving on to the sensory part of your cranial nerve 5. So there's 3 branches. We're going to go with sensory, and I'm going to grab this here, and I'm going to have you close your eyes, and I'm going to touch you, and just let me know when you feel anything, okay?
Yeah. 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 Yeah.
Great. All right, sensory's looking good. Again, now I'm going to look at your corneal reflex. So this might make your eyes water a little bit. Is that okay?
It's okay.
All right, look up. Great. Great. Good reactions. Okay, so, and then last thing for, nope, actually that was the last thing for your cranial nerve. All right, so for 5. So now we're moving on to 7, your facial nerve. So I'm going to have you, raise your eyebrows, and then frown for me. Close your eyes, show your teeth, smile, and then puff out your cheeks. Great. Awesome. And then I'm going to have you close your eyes super tight for me so I can't open them. Great. All right, now 8 is your acoustic. This is involved in hearing, so I'm going to whisper something in your ear. It's not going to make sense, but just repeat it back to me, okay?
Purple 10.
Yep. I'm going to do your other ear now.
11-4.
Great. That was right. Okay. So now we're going to move on to 9 and 10, glossopharyngeal and vagal. So I've been listening to your voice. You have a great palate. Nothing is concerning there. I'm going to have you say ah while I look back at your soft palate and pharynx.
Ah.
Beautiful.
Ah, or no.
Nope, that's good. That's all you need. And then, oh. And then I'm going to test your gag reflex. The back of your throat. Is this okay?
Yes.
Oh, perfect. Great. That's exactly the reactions we were hoping for, so all good there. Now we're moving on to cranial nerve 11, which is our spinal accessory. So I'm going to have you shrug your shoulders and turn your head against resistance.
Okay.
So, all right, shrug your shoulders. Great. Turn your head this way. Great. Turn your head this way. Great. Everything's looking good so far. And for our last cranial nerve, the hypoglossal, this is going to look at your symmetry, deviations of motion, and the strength of your tongue. Yes, so I'm going to have you open your mouth. Yep, and then have your tongue inside. Great. Perfect. And then side to side. Great. Yep, that's perfect. All right, so that's all for your cranial nerves. Now, huh?
Did you push on my tongue?
No.
Oh.
No pushing.
Awesome.
You passed.
Sometimes I'm a speech pathologist, so sometimes I do that.
She's a genius. And then I'm going to look at your coordination.
Okay.
So first we're going to start with your upper extremity coordination, then we're going to move to lower. So what I'm going to have you do, as fast as you can, have your legs uncrisscross, and I'm going to have you pat, and then turn around and pat, back and forth as fast as you can. Great. Perfect. Pass with flying colors. And then I'm going to have my fingers out here, and I'm going to have you touch my finger, and then touch your nose. Okay?
Yes.
Does that make sense?
Touch your finger and touch my nose.
Yep, back and forth. So one finger. Great. Other finger. Perfect. There we go. That was great. Okay, and then now I'm going to test your lower extremities. So this one, I'm going to have my hands underneath your feet, and I'm going to have you tap down as fast as you can.
Do you like my slippers?
I love them. They're perfect for this. And
So,
tap. Yep. Great. Perfect. And then I'm going to test your lower extremities also. So have your legs out. I'm going to have you put one heel on your knee. And can you drag your heel down to your big toe? Great. Other leg.
Do you want me to show you or do you trust? I can take off my shoe.
No, I see it.
Okay.
Great. Perfect. All right. And that's for all for your lower extremity. Now I'm going to look at your walk, see if you have any symptoms of gait occurring. So I'm going to have you stand up. And if you could walk to the camera and back, just normal. Great, that's perfect.
Awesome.
Now I'm going to have you walk on your toes, here and back.
Oh, yay.
Beautiful, great muscle tone. And now one more time on your heels.
Ooh.
Yeah?
I feel like a penguin.
Uh-huh. Perfect. Checks all around. Now, if you could hop in place.
How many times?
Just like 3 maybe. Great. Mobility's looking great. And lastly, I'm going to look at your stance. So I'm going to have you go into a Romberg position where you stand with your feet together and your eyes closed. And I'm just going to want to do you for like 10 seconds.
Okay.
Great, no sway. That was awesome. Now, last one is pronator drift. So I'm going to have you stand just like that. Have both of your arms stretched out, palms down, and close your eyes again. Perfect. No swaying. You held your position. Coordination is great.
Yay.
Good job. Okay, I'm going to look at your motor system real quick. And you can sit back down. No worries there. Can you hold your right hand out for me? Great. Now your left. Great. I was just making sure you had no signs of tremors or tics or anything of that nature going on. And I've been observing your body position and movement as the exam has gone on. It's been great. I know you need to fix your posture. And then also you don't have any apparent signs of muscle atrophy, great muscle tone and contour and symmetry. So we're good.
Cool.
Lastly, last part of the test is I'm going to look at your muscle tone strength. So for this part of our examination, I'll be touching a lot of your muscles. Is that okay? Yeah. Great. So we're going to start with your elbows. I'm going to have them, set this down. Great. I'm going to have your legs uncrossed, your elbows flexed. Yep, thumb towards you. And then I'm going to have you push against my wrists, like forward, while I push against your wrist at the same time. I'm going to provide resistance. All right, press.
Great.
Perfect. Now I'm going to test your wrist extension. So I'm going to have your wrists are still in a fist, arms out front, both arms. And now I'm going to try to push down while you push up on my hands. Okay? Great. Very symmetrical. Everything is looking good there. Now I'm going to test your grip strength. So I'm going to squeeze. I'm going to have my fingers together. I'm going to have you squeeze them as hard as possible. Don't let me break. Okay. Great. Other hand. Perfect. All right. Now I'm going to look at your fingers. So if you could separate them. I'm going to press on the outside. Don't let me close. Great. Now the inside. Perfect. Everything is looking great so far.
Besides my nails.
Physically. And also lastly, I'm going to have you touch your thumb to your pinky. Great. All right. So now to your lower extremity muscles. So yeah, sitting down, I'm going to touch your thigh for this. And I'm going to have you try to raise your legs while I press down. I'll do one at a time and then simultaneous. Okay. Okay. Great. Great. And then same thing, except the opposite way. So I'm gonna put my leg under. Yep, and have you push down. Great. Do it. Great. Good muscle tone.
Comment there.
All right, and now I'm gonna look at your abduction and adduction of your hips.
Okay.
So if you could scoot towards the edge of the chair.
Switch it around.
Yeah. Okay. That's great. So try to press out against my hands. Great. Now press in against my hands. Great.
It's like a machine at the gym.
It is. That's exactly what I thought of too when I did it on myself. Okay, and then same thing with your knees. I'm gonna bend down here. Try to press your leg up. Kick your leg forward. Great. Other. Great. Now extend one leg and try to push down. Great. Okay. Great. Awesome. And then last thing, I'm gonna look at your ankles. So I'm gonna have your feet a little. It's in dorsiflexion position, so they're at an incline up with your toes up. Other way, your toes. Yes.
I'm gonna take my shoes off.
Okay, yeah, great. All right, press against. Perfect. Now press down. Great. Awesome. That was all for your muscle strength testing. You did amazing.
Oh, my trainer that.
I know, it's so strong. Okay, I'm gonna look at your sensory system now. So I'm gonna take my cotton swab here and just let me know. I'm gonna have you close your eyes again. Let me know when you feel when I'm touching you.
Okay. Feel. 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 Feel.
Great. One more time.
Feel.
Does that feel different? Okay.
Feel. Oh, yeah, maybe.
Feels different?
Yeah. Yeah.
Great. What did the second one feel like?
Like sharper.
Yep. That just tests to make sure you are able to discern between light touch and pain.
Gotcha.
So now I'm going to look further at your sensory system, and I'm going to touch both sides of your body simultaneously. So if you could have it here and also close your eyes. All right. Let me know where you feel my touch. Okay.
Shoulders. Elbow. Knees. Hands.
Great. Perfect. It's all looking even, which is exactly what we want. And then I am now going to have you, I'm going to hand something to you when your eyes are closed. I'm going to have you try to discern what it is. Okay. Ready?
The pen.
Yep. One more.
My glasses.
Yep. Perfect. All right. That was called stereognosis. You did great. Now I'm going to write a number in the palm of your hand, and I'm going to have you see if you can discern it, okay?
I love this game. 9.
Yep.
0.
One more time.
Oh, 6.
Yes. Perfect. That was called graphesthesia. There we go.
That as a kid.
I know,
My
it's
mom
so
would
fun.
on my back.
Yes, exactly. Okay, so I'm going to now test your 2-point discrimination. Basically, I'm going to touch you in 2 places, and I'm going to see where you feel them. So if you could close your eyes for me. And when you feel it, just point to where you feel it, okay? Okay. 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 Great. Good job. Again, that was 2-point discrimination. Now I'm going to test your point localization, which is pretty similar, but I'm going to touch you and let go, and then you're going to tell me where I pointed, okay? And only one place as well. Okay. Great.
Oh, I opened my eyes.
No, that's okay. Great. Great. Perfect. Everything's on point. You're pointing in the right direction. And then, let's see. Areas, and that was extinction. So perfect. That was good. And then, let's see, for your proprioception, I'm going to have you close your eyes. This one's a little silly. I have you close your eyes, and I'm going to move your big toe up and down. And I'm going to stop, and I'm going to see if you can guess whether it's up or down.
Okay.
Once you stop. So your eyes stay closed the whole time, and I'll do this on both your toes.
Okay. Have fun.
All right, close your eyes, and I'm going to grab it from the side as well. Okay, ready?
Up.
Yep. Okay, other toe. Wait, let me get a hand. There we go.
Down.
Yep. Perfect. Good job.
My toes don't wiggle that much.
I know. It's hard to get them to relax too.
Mm-hmm.
Okay, great. That was your proprioception. It's all looking good. Very final part of the exam now. I'm gonna look at your reflexes. Start with your upper extremities, then test your lower. So I'm gonna start having your arms flex, the palms down. So right here, like yes, perfect, tabletop. And then I'm going to, I'll put this down again. Should have set it right here. I'm gonna have my thumb over right here. I'm gonna have you like here, yeah. And then I'll use my hand in order to strike your reflexes. And I'm gonna test right here. Okay. Great. That's perfect. That was great. So now I am going to test your brachioradialis. So I'm going to have your forearm out and slight dorsiflexion. Yes, perfect. Just right there. And I'm going to see right. I'm going to measure about 1 to 2 inches above your wrist. I'm going to have you relax also. Yeah. Great. Great. Those reflexes are looking good. So now I'm going to move to your lower extremities. I'm going to have you legs out. Yes. And first I'll look at your patellar tendon. So I'm going to strike right below your knee. Great. Great. Okay. And then I'm also going to now look at your ankle jerk. So again, I'm going to have you take your foot out of your shoes. Have them slightly at an angle up, dorsiflexion. Great. Perfect. All right, everything is looking good in your lower extremities. And then lastly, I'm going to look at your cutaneous stimulate reflexes. So I'm going to have you kind of have your arms out to the side. This is going to be your abdomen. So I'm going to do it simultaneously, actually. Both arms at the same time. Let me know if anything feels weird. Great. I'm just drawing an X, making sure that looks good. And then I'm going to have your feet out again, out of your shoes. And then I'm going to stroke the bottom of your feet. Great. Great. All right. That was the final part of my exam. Do you have any questions for me?
Nope, you did so good.
Great.
Did I do good?
Yes, you did great. You passed with flying colors. Everything was in normal range. There are no neurological deficits that I'm worried about. All 12 of your cranial nerves are functioning properly as they should. Your reflexes are reacting as they should. But if you start to see signs of deficit, things aren't working correctly, you're getting dizzy, you have eyesight loss, hearing is off, come back and we'll check you out.
Okay, awesome.
Great.
Thanks so much. It was so nice to meet you.
Yay! That's how long it was.